Good morning, everyone. It's 11 o'clock and I want to get started because we do have a lot of information to cover over the next hour. Talking about alcohol-related dementia, malnourishment, vitamin deficiency, medication interactions, Creutzfeldt-Jakob disease. There's several other things we're going to discuss in this hour that's not on this initial slide here. But thank y'all for being here. I'm Jamie with the James L. West Center, and my colleague Holly is with us today as well. I want to get through the content and make sure and leave a few minutes at the end to answer any questions that might pop up as well, but also feel free to chat in any questions that you may have or experiences, or if you unmute and just say, hey, Jamie, stop. I have a question about something, or I want to share something, please feel free to do that as well. We are recording today's program, and this afternoon I will send out a follow-up email with a copy of the recording, a copy of the slides, and a link to an evaluation. So we are offering 1 hour of free CE credits for nursing, social work, and licensed professional counselors. So when you get your email today, there will be a link for an evaluation. When you complete that evaluation, then within the next several weeks, we'll get you your CE certificate out to you. And there'll be instructions in the email about timeframes for the CE credits. But please take advantage of those if you are able to. The James L. West Center, if you're not familiar, we are a nonprofit organization that serves persons impacted by dementia. So those are persons living with the disease. There are residential and respite care and our day program care that we are very ferociously working at getting back open due to COVID, and through our caregiver education through working with caregivers, family and lay caregivers, and professional caregivers as well, and of course the community at large. Today's program are outlined for our CE credits, and we are going to describe the common signs and symptoms, again, of alcohol and drug-related dementias, medication interactions, malnourishment, vitamin deficiencies, and Creutzfeldt-Jakob disease. We'll talk about risk factors for each one of those, as well as understanding the effects these conditions can have on the brain, particularly when they're not managed well. And then we'll discuss some common treatment options for each one of those conditions. So it will be a lot of content, and some of the slides I'll go through fairly quickly, but again, you'll get a copy of these slides this afternoon for you to follow up on. Talking about age-related changes. So starting off with some medication interactions, because our bodies and our brains do change as we get older. Our older brains change in structure and our ability. Now, I want to clarify anything for anybody, particularly with dementia and memory loss. Memory loss and dementia is not a normal part of aging. What is normal about aging, particularly when it comes to the brain, is it slows down a little bit. But when we're losing memories or having cognitive, really bad issues, that is not a normal part of aging. So understanding that, and we have other programs about what do you do when things are normal, are not normal, that can get a proper diagnosis and starting down that process. But know that there are things that change. Our brain gets a little bit slower, okay? Our weight as we get older also can affect how medications interact with our body. So it can be whether we're overweight or underweight. It really will affect how much a medication will stay in our system, depending on our weight. But also included in that is our digestive and circulatory systems, the kidneys and the livers, how the medicine processes through our bodies. Medications can enter our bodies and how they leave our bodies, how fast they're metabolized within our system or how slow they're metabolized within our system. So they can stay longer in our systems as we get older, just because of those circulatory and kidney systems are slowing down as well, like the brain systems are. The statistic here is 80% of older adults have at least one chronic condition, and half of older adults have at least two. So most older adults, and that's, older adult is 65 plus, is living with at least one chronic condition. And when we have at least one chronic condition, they're taking at least one medication, if not several medications. And the complications of those medications and the effects of the medications and medication interactions can really interact in negative ways for persons with, for older people, particularly in brain. What they're typically see is when you have interactions in medications or side effects of medications, what it typically looks like are the symptoms of dementia. So you see more confusion, you see more memory issues, you can see more changes in personality or judgment. So those same symptoms that you see in somebody with dementia are commonly the same symptoms you'll see in somebody that's having some medication interactions within their system. So it says here, many of these side effects, particularly in the older population, can be mistaken as dementia. So we want to make sure that we're getting treated for the right things, right? There are certain groups of medications that do affect older adults' cognition. And these are groups of medications that have been identified that can affect an older person's cognition. And I will say there are certain medications within these groups. So there are certain antihistamines that have been shown that can affect an older adult's cognition, certain anti-anxiety and antidepressants, certain sleep aids, antipsychotics, certain muscle relaxants, medications used for urinary incontinence or your bladder problems, and antispasmatics. Some of those medications, certain ones of those medications are shown that can really affect an older person's cognition. So this is memory, but cognitive decline as well. So really talking to a trusted doctor or another healthcare professional, and this can be a social worker, it can be a pharmacist, about prescription use that's prescribed by doctors, but also anything that somebody's taking that's over the counter. Because what happens a lot is an older adult has their prescribed medications, and they might have 1 or 2, but they also might have 8 or 10 prescribed medications that they're taking. But then they also have medication they prescribe themselves. So all these over-the-counter medications that they're taking, whether it's a low dose of air, or it's supplements, or it's vitamins, or it's herbal things that they've decided to add to their medication regimen that can interfere with the prescribed medications. And whether that's negate the effectiveness of those prescribed medications, or it has a negative interaction with them. So really talking to those healthcare professionals if any of those groups of medications are prescribed, but also as an older adult, and advocating for older adults and educating them, really letting them know that they have to tell their doctors and pharmacists and other healthcare professionals all the medications that they're taking regularly. So we have an understanding of what could be going on with somebody. And the Beers criteria, this is from the American Geriatric Society, that's AGS, American Geriatric Society. This is a list of medications that doctors, nurses, pharmacists, you name it, have put together that really they recommend that are not safe or not appropriate for older adults. This is not, the Beers criteria doesn't have an exhaustive list, and it's been around for several years, but it was most recently updated in 2019. So for those of you that might be familiar with it, there were quite a few updates that were made not too long ago. And here are these 5 things listed that really they're medications that have been shown to have evidence that suggests they should not be used for an older adult. And either it's avoided by most older adults. And I like how they specified outside of an older adult that's not on hospice or palliative care settings. It needs to be avoided by people with specific health conditions, but also avoided in combination with other treatments and risk for the drug-drug interactions. Should be used with caution or avoided or try other alternative treatments because of potential side effects of these certain medications, or dosed differently, particularly if they have kidney conditions or even liver conditions that will impact how the medicine is processed throughout the body. So there's that Beers criteria, and you can just Google that and it comes up with that. It's a pretty exhaustive list, but having that, or at least having that for older adults to look through. So as we're talking about medication, and we're going to talk about some more drugs and alcohol use, because really are being aware of the medications and how they affect the brain, but affect the whole body, but alcohol and drugs as well. Alcohol abuse is unfortunately pretty common among older adults. It says 8% have a serious drinking problem, but 60% report drinking regularly, and 5 to 10 report binge drinking. And, are those numbers skewed? How many people are really reporting honestly? I don't know. But alcohol-related brain damage, they're suggesting can account for up to 10% of dementia in persons under 65. So we are seeing more people diagnosed that are under 65, and we're seeing, unfortunately, some of that is alcohol-related dementia. And we're talking about binge drinking or heavy alcohol use for this drug-related or alcohol-related dementias. And binge drinking is 5 or more alcoholic drinks, or for men, 4 for females, at the same time or within a couple of hours of each other. And they're doing at least one day in the past month. So it's, a month goes by and I'm having a bunch of drinks at one time. Heavy alcohol use is binge drinking 5 or more days in the past month. So I'm doing that binge drinking at least 5 times during the month. So understanding what that is as we talk more. But alcohol kills brain cells and causes severe damage to your brain. So the picture here is a normal 43-year-old and somebody who has alcoholism. So they've abused alcohol for a really long time, and you can just see the drastic difference there in those pictures. So not only is it shrinking parts of your brain, but there's also the other things that come along with alcohol abuse, which is blurred vision, slurred speech, poor judgment, poor decision-making, memory loss, because of the damage that's happening to the brain. They're also showing that persons with alcoholism or that have severe heavy alcohol use and binge drinking have a smaller hippocampus. And the hippocampus is that part of our brain that is our learning center. So it helps us take in all the information from a day, helps us process it, record it, for us to learn new things. It's that short-term memory center. So persons with alcohol dementia, related dementia, are having that smaller hippocampus. The hippocampus is also the part of the brain for somebody with Alzheimer's disease. That's the part of the brain that gets attacked first as well. So you'll see the symptoms being about the same, that poor judgment, poor decision-making, memory loss. But alcohol-related disorders or alcohol-related dementias are caused by chronic heavy drinking. So this is years of heavy drinking. The damage is related directly to the exposure of drugs and alcohol. And the CDC reported about 17% of the adult population report binge drinking, and 6% report heavy drinking. Again, are we reporting correctly? I don't know. But particularly with the effects of the pandemic that came up, we have seen the use of the sales of alcohol go up, and the prescriptions for antidepressants and anti-anxiety medications are up by 34%. And you can see the sales are up in alcohol, 41% in women and 54% in men. And I would venture to say that those percentages have not gone down. But alcohol-induced dementia can be acquired if one gets intoxicated with alcohol regularly. Again, it's that chronic heavy use of alcohol. And what's happening is the intoxication depletes the nutrients in the body. So not only is there serious damage happening to the brain, but there's also serious damage happening to our organs, our kidneys, our pancreas, and more. So it's just toxic for the body overall. In the study in the Lancet Public Health Journal, this was done from 2008 to 2013, reported that alcohol abuse is the most significant prevalent factor in a dementia diagnosis. They also, one of the co-authors also said it's especially important for those with types of dementia that are start before age 65. So we do see more alcohol-related dementias or disorder to people that are under the age 65, but also knowing that that older population does consume quite a bit of alcohol too. Alcohol really prevents our neurons from regenerating and from making strong connections and working well. So if their neuron is not able to regenerate or make connections with other neurons throughout the brain, it can't work. And when it can't work, it dies and it withers away. So while anybody can really struggle with alcohol, this condition is becoming more common in middle-aged and older adults. We talked about the heavy drinking and the binge drinking, but the National Institute on Alcohol Abuse and Alcoholism defines heavy drinking as 4 drinks a day for women and 5 for men. So in the alcohol, again, it has the neurons, or stops the neurons from regenerating and connecting, and the neurons die. So it has a neurotoxic effect to the brain and can really cause structural damage, which we saw in the picture as well, but the brain is not able to function like it used to. It also is a major risk factor for other brain disorders, such as epilepsy, traumatic brain injuries. It can also lead to or be a contributing factor to other dementias as well. It also gives us high blood pressure, high cholesterol, irregular heartbeats. It can increase our risk for strokes, and is also associated, again, with a vascular dementia. The other thing that happens when we tend to drink or abuse alcohol is we also start to do other negative things or other negative habits that contribute to poor health. So when people are drinking heavily or drinking regularly, you also see a higher rate of people that are smoking, a higher rate of depression and other addictive things that go on in life, or other addictive choices. Also, you do see, it's not on here, but poor eating habits, people that don't exercise as much, and then sleep is also hindered by alcohol. So alcohol stops the brain from going into circadian rhythm that really helps us get good quality sleep. So you're also not getting the right sleep the brain needs to be able to work effectively. So risk factors for alcohol, heavy alcohol abuse. You don't need to be a binge drinker to increase your risk for developing dementia. What many studies have said over and over again, and diets have said, is to limit your drinking. Recommended limit is 14 drinks at a week at a maximum of 2 drinks a day. What we're typically hearing is that for alcohol, for a normal use, or it should be a healthy use of alcohol, I should say, it's 1 drink for women and 2 drinks for men per day. And when I say a drink, that's the ounces. It's 6 to 8 ounces of either it's wine or beer or liquor. It's that 6 to 8 ounces. It's not that the whole bottle. Mm-hmm. And then, of course, the drinking, and particularly binge drinking or heavy alcohol use, also increases our risk of using other lifestyle choices like tobacco. That increases your risk for dementia. So more symptoms that you will see, of course, memory problems, language impairment. You have the slurred speech, but you also have language impairment, and inability to perform tasks or complex motor tasks like dressing. Driving would also be another one. You can also see people might have nerve damage in their extremities, like their hands or their feet. It's called peripheral neuropathy. And this is because of some of the damage that's happened to the brain, the cerebellum that controls coordination. You can have tingling or numbness in those, but you can also see coordination and just their unsteady on their feet, not able to, again, to do those motor tasks like they used to or should be able to if they weren't abusing alcohol. At higher risk for falls, again, because that cerebellum is being affected by the alcohol. And with falls, you're at an increased risk to hit your head and then have a brain injury of some sort. So you can see a decline in cognition because of that. Alcohol also, again, damages the heart, the liver, the kidneys, the pancreas. So you can see some other conditions come up because of the damage happening to those organs. And you do commonly see abnormalities, of course, in the liver or the heart, and it's called alcoholic cardiomyopathy. And this is the damage to the heart and to the lungs that cause additional brain complications and a much higher risk for strokes because you have low blood flow to the brain. And then also alcohol, along with all the physical effects that it does throughout your whole body, you can have some psychiatric problems with alcohol as well. And these are associated, can be associated with dementia. And you can see some of these symptoms occur before you see any cognitive or memory or intellectual loss. Is in persons that have an alcohol-related dementia, you might see some of these psychiatric problems first before you see any cognitive problems. And this can be depression or apathy, higher anxiety, irritability, any psychosis, but resistive to care or help from others, and personality changes. This can be seen as impulsive or hostile behavior that can, it's impulsive and hostile behavior that requires medication. And then it can also, how the neurons are affected generally is it's the frontal lobe that's affected a lot. And of course, that cerebellum. So you're more prone to injury because your coordination and movement is off. But the frontal lobe houses a lot of our judgment and our impulse control. So if this part of the brain is being damaged, I might be using really poor judgment, and I might not be as in control of my impulses or my emotions. So I can have really poor decisions, really poor judgments on things, and more prone to injury. So like dementia, I'm going to kind of veer off into this Wernicke-Korsakoff because this can be a part of an alcohol-related, or it is an alcohol-related dementia, but it goes into, because it's heavy alcohol use, the body's not getting enough vitamins, certain vitamins that it needs or nutrients that it needs as well. So this is alcohol-related dementia is a broad term, and the Wernicke-Korsakoff Syndrome can be an effect of an alcohol-related dementia. The Wernicke-Korsakoff Syndrome is a more specific condition because it is a thiamine deficiency, and thiamine is a B12 or B1 deficiency. The alcohol is not letting the body get any vitamins B1 or B12. It is the most prevalent form of an alcohol-related dementia. And what it is it's Wernicke's encephalopathy, I'll say it in a second, and Korsakoff's dementia. The alcohol is preventing the body from properly processing this thiamine that it absolutely needs. So the encephalopathy is the deficiency that's come because you're not getting the thiamine, because the alcohol is not letting it, but also excessive drinking because you might be vomiting or voiding in other ways as well. So the body just can't keep it in its system either. It's not going to process it, but it's also not going to keep it in. So you're depleted and deficient in it. Thiamine, the vitamin, the B12 vitamin really helps our brain with the glucose that it needs to really be able to function optimally. Our brain has to have some sugar and glucose. It really needs about 70% of glucose that enters into our body for it to function. So if we're not getting enough of it or getting it at all, then our brain isn't going to be able to function. And you can see that it looks like a lot of loss of coordination or stumbling, unsteady on your feet. You can also have abnormal eye movements back and forth, and then just confusion, a general confusion because you're not getting that stuff. When that is left untreated, what happens is the Korsakoff syndrome sets in. And Korsakoff's dementia, and this is directly related to the severity of the alcohol and the damage it has on the neurons in the brain, which leads to dementia. So you will see the symptoms that are related to language difficulties, memory loss, confusion, depression, and any other cognitive conditions that you might see. So let's watch this short video, which will explain the Wernicke-Korsakoff syndrome a little bit better.
Another neurological disorder affecting memory is Korsakoff syndrome, which is caused by a lack of vitamin B1 or thiamine in the brain. This disorder is strongly linked to severe malnutrition, eating disorders, or especially alcoholism, because these groups often don't ingest or are unable to process all the nutrients their bodies need, including thiamine. Thiamine is important because it's responsible for converting carbohydrates into the glucose your cells need for energy, and it's especially important for the normal functioning of your neurons. At first, a person developing Korsakoff syndrome might have damage to certain parts of the brain, resulting in poor balance, abnormal eye movements, mild confusion, and or memory loss. At this stage, it's actually called Wernicke's encephalopathy, which is the precursor to Korsakoff syndrome. If Wernicke's encephalopathy is diagnosed in time, then it's possible to reverse the damage, or at least prevent more of it. If untreated, however, the disease will progress into full-blown Korsakoff syndrome. The main symptom of Korsakoff syndrome is severe memory loss. And this symptom is often accompanied by confabulation, which is when the patient makes up stories, sometimes to fill in the gaps in his or her memory. Unlike AD, Korsakoff syndrome is not necessarily progressive. If diagnosed and treated, people can get better. People are often treated with thiamine injections or other medication, and they have to stay on a healthy diet and abstain from alcohol. And some people may also need to relearn some things. The effectiveness of this treatment really depends on how early the disease is diagnosed and how well the patient follows the treatment guidelines.
So that is a great explanation of Wernicke-Korsakoff syndrome, but also helps us lead into how damaging alcohol can be to our system, especially when left unchecked, and really how it really affects our brain. Now, other possible causes of Wernicke-Korsakoff syndrome, because it's that deficiency in the vitamin, the thiamine, you can have a loss of vitamins from renal dialysis. If you have some metabolic illness as well, or you have malabsorption due to other conditions like anorexia, IV feeding, people that are fasting and maybe in an unhealthy manner or not being under a doctor potentially, or any GI surgery and they're just not managing the treatment or the recovery of that well, because the body's not getting the thiamine that it needs or other possible vitamins that it needs for the body's the cells and the neurons in the brain to optimally work in the way it needs to. So to get a diagnosis of this, it does require, just with any type of dementia, it's kind of a ruling out process, and it requires careful clinical history and physical examination, usually a group of doctors working together or interdisciplinary team working together. It resembles the alcohol-induced dementia resembles other types of dementia. So it cannot be confirmed with a simple clinical history. There's like I mentioned, a kind of ruling out process of what it can be. It is underdiagnosed as well, because remember I mentioned it's typically people that are under 65. It's the most common that you see that. But we also, when you see it in elder patients or the older populations, here it says is doctors don't recognize alcoholism in the majority of elderly patients. And then there is that whole attitude of, well, just let Granny have her drinks. What's the harm? What's we're going to do? Well, there is a lot of harm. If it's too many drinks, there's a lot of harm for Granny. So being an advocate about that. And also changes that are happening with alcohol abuse or alcohol-induced dementia can be nonspecific, or they can be very ambiguous. And it is generally thought as intellectual loss, or maybe it's just a normal part of getting older, but really having to look at the whole person and what's going on. And there are brain imaging that can help, but neuropsychological testing that can help as well, and being honest with behaviors and what you see. Again, treatment for this sobriety is the number one treatment, which means that and like I mentioned in the video, it doesn't have to be a neurodegenerative or progressive disease. It can stop and get better, or it can stop and maintain where you're at, depending on if you're getting the right vitamins and nutrients into your body. You're abstaining from alcohol. Any management of other conditions that might have happened, with whether it was due to kidney attacks or liver failure or something like that. And being a close watch on your heart too. But it says here long periods of sobriety for patients with alcohol-induced dementia can result in small and slow improvements over time. And some patients will stabilize after a while. So it's well established that alcohol use disorders damage overall health and overall well-being, and can contribute to a shorter life expectancy by more than 20 years. But with treatment and recovery, many of the ill effects of the alcohol abuse are diminished, and patients can see a significant boost in their physical and mental health. So it's important to get this diagnosed and get it addressed as soon as you possibly can. But talking more about malnutrition and vitamin deficiency, because we know just with the Korsakoff's or the thiamine deficiency, how that really can affect the brain. So can other deficiencies in vitamins, and we're just not having some malnutrition. And malnutrition is really, and vitamin deficiency is defined as a person's diet does not provide enough nutrients or the right balance of nutrients for optimal health. And this affects all groups of people. 9 million older adults can't afford nutritious food. 1 in 4 adults 65 and older either skip meals or reduce meal sizes, or they're giving half of their meal to their pet. Up to 60% of older adults in healthcare settings are malnourished, and 16% of independent older adults are at high risk for malnutrition for various reasons. It also affects all sizes, and this is important to note too, because you can be malnourished and be overweight, and be malnourished and be underweight. It says about 1 in 3 adults 65 plus are overweight and malnourished, and about 715,000 adults 65 and plus are underweight and malnourished. So risk factors for this, the malnourishment, and when we're malnourished, we're not getting the vitamins that the body needs. Can be reduced in food intake due to mental health, because they're not, can be early signs of dementia. They're not remembering that they already ate or recognizing that they need to eat. They just have a poorer appetite. Mobility problems, hard to make the food and get the meal and go to the grocery store, and it takes a lot of energy to do that. Other chronic conditions that can, for a variety of reasons, have poor appetite. Limited income. Living alone in isolation, the side effects of medication can cause poor appetite or anything like that, or just feeling ill overall and not wanting to eat. Depression, dementia, fad diets. Fad diets can, sometimes what the fad diet is they restrict a certain nutrient that your body may need, so you can become deficient depending on what that diet is restricting. Any gastrointestinal disorders, you're eating too much fat, too much sodium, too much sugar, so the body's not getting other vitamins or nutrients that it needs. Or your body's just having a hard time absorbing nutrients. You might have something else going on. Poor dental health, so it hurts to eat. And then trouble with swallowing or chewing. Any other digestive orders, of course, alcoholism. Or if you have a nutrient loss due to other ways to avoid, whether we're vomiting, we have a dialysis, or diarrhea that's not being managed or treated. So it's just the body's being depleted of those nutrients through those ways. How you also see malnourishment and the effects on the body is as we age, our bodies, we naturally lose some muscle tone and bone density, but malnourishment accelerates those losses. So it really impacts our independence and our autonomy if we're malnourished, because I may not be as mobile, I may not have great posture, I may have more falls, and may not have as much strength. And if I fall and break something, I'm going to have a much harder time to recover from that or go back to the way I was before. And then the healing in the immune system. Being malnourished, a lack of nutrition, and nutrients in our body really decreases our white blood cell count. It really makes it harder for our body to heal, but also fight off infections and illness. Other things that it does to our organs, it harms our eyes. Our eyes need vitamins, and it can increase our risk for glaucoma or cataracts or macular degeneration. A lack of fluids and electrolytes cause our kidneys to overwork, can lead to dehydration pretty quickly, joint pain, and heart disease. You'll see the skin change. It can change color. You can see changes in your nails, where they become brittle. Excuse me, they have more ridges in them. Those are signs of malnourishment, or they become spoon-shaped. Loss of hair. You can notice an increase in irritability or depression and anxiety. And then you also see with the malnourishment or the deficiencies of nutrients, how it affects the brain, because you can have loss of speech, some language difficulties, poor coordination, poor memory or memory loss, lack of concentration, more confused, more disoriented, and then an increase in apathy. So to prevent or treat malnourishment, adjust your diet to make smart food choices. And this can be talking to your doctor, maybe getting a referral to a dietitian to really what your body needs. Your body needs all nutrients. It may not be an increase in food, but it might be an increase in certain foods that has the nutrients. There's the choosemyplate.gov, which I'll show you an example of here in a second, that includes all the food groups that the body needs. And hydrate, increase your water intake, maybe decrease the alcohol or decrease the caffeine intake and really drink more water. Water is a nutrient and it's an important nutrient. Our body is mostly water, so we need water to optimize, to function optimally. Talk to doctors about possible side effects from medication that can make a poor or cause a poor appetite, or maybe make our body harder to absorb certain vitamins. And exercise, exercise helps build that muscle strength. It helps our heart health, that bone density, and it helps us keep our balance up and feel more confident on our own 2 feet as well. And then making sure you have good dental care, taking care of your mouth and your teeth. Overall, oral health really can have a positive and negative impact on your life, but it can lead to gum disease. It can lead to other dental problems, to where it really does affect your food intake and your ability to eat well or eat certain foods that are vital to your good nutrition. So this is an example of the choosemyplate.gov. So it has on here fruits, focus on fruits, and there's a variety of them. Vegetables, of course. A variety of vegetables. Eat more dark leafy greens, more orange vegetables, more beans. On here, it also has physical activity. This is part of your diet, is physical activity, and a balance between food and physical activity. Oils, so knowing your fats and how we cook our food is important. So most of your fat sources from fish are going to be your healthy fats, or from vegetable oils or things like that, or nuts. And we want to limit the fats, the solid fats. So if it's a solid like a butter or a margarine or lard, we want to limit those or get rid of them altogether and use more healthier fats. Milk can be calcium rich. It helps with that bone density. So choosing good, low fat or fat-free milk, or if you're lactose intolerant, there are a variety of other options out there, but have different types of milk that have a lot of calcium in them. And then grains. This is saying make at least half of your grains whole. So it's a whole grain. So it's the whole brown rice. It's the quinoa. It's the orzo. It's it's looking for the word whole before the name. So it's whole pasta, whole grain that you want to see, because if it's not whole, I mean, it's been processed, and that processing takes the nutrients out of the grain. And what we want is the nutrient. So we want to keep the whole grain to make it there, or to get the benefits of it. And then meats and beans. We want to have protein in our diet, but have lean protein. Beans are a lean protein, but if you're choosing meat, it's the lean meats. It's your fish, your poultry, for those. And how you cook it is important too. So frying it up may not be the best choice, but you can bake it, roast it, grill it, you name it. So this is a good just overall picture of how to have a good diet. And all of these things, if you follow it, depending on how strictly you adhere to certain diets it gets all of the nutrients that you need within your body. But it is talking to your doctor. So what does your particular body need? And variety of food really helps get the nutrients you need, because if we stick to just like meat and potatoes, you're not getting everything. We have to have a variety to get everything. And that's what that Choose My Plate really helps with that. But another way to look at it is make sure that your plate has a variety of color on it, natural color, not processed color, but natural color. Foods that have color with them. This is the leafy greens, the colory vegetables and fruits. Those really have the high nutrients in them. The more colorful, the better they are, as far as nutrients go. And the healthiest foods are the whole foods. And we've generally found whole foods on the perimeter of the grocery store. So if we can stay just on that perimeter instead of going down through the middle aisles, that's where the more processed foods are. So just stay on the perimeter and purchase food from there. And being a smart shopper, just knowing what labels say and how to read them. And, you know, you might like a certain cookie, but maybe we get one that has less sugar in it or something. Or the yogurt is a great example. You want to have yogurt every day, but there's some yogurts that are highly processed and have a lot of added sugars in them. And there are other yogurts that are better for you, have higher protein, higher fiber, and natural, no added sugars in them. They just have the natural sugars. So being smart about those. And other, you know, it's talking to your doctor. If you have any unplanned weight loss or weight gain, it's really talking to your doctor about what's possibly going on here. If you've noticed difficulty in chewing or swallowing, or you have, it could be ill-fitting dentures, or you do have some other oral health that could be really affecting your eating. But also talking to them about oral nutrition supplements. Supplements can have a lot of fillers in them because they're not really regulated. They're not regulated by the FDA. So really talking to your doctor about what do I really need and what brand would you suggest I go with? But also talking to the pharmacist as well. What do you think as far as a brand would go for a certain nutrient? You know, an example I have is I do have to take iron as a supplement. That's prescribed by my doctor, but that my doctor told me which brand that they would prefer I take because they have more evidence that it works better than other brands. So really talking to them about that as well. And if you have other barriers as far as transportation to get there, or there are maybe financial issues on how to get there, there's a lot of help, particularly in this community, the Fort Worth, Dallas community, to help with that. There's the supplemental nutrition assistant programs. There's Meals on Wheels that can do home delivered, and they're nutritious meals, and they offer a variety of other programs as well. And how to find these resources for you, you can call the Tarrant County ADRC, which is Aging and Disability Resource Center, and they can particularly find what you actually need and get you to the contact of the person that you really need to talk to. And when I send you out the slides this afternoon, I'll make sure and have that phone number connected to that too. There's just some information about vitamin deficiency and persons that have some memory issues. There was a study from the University of Wisconsin that said 40% of geriatric memory patients were deficient in at least one vitamin linked to brain health. And some of those vitamins are vitamin B, so vitamin B6, B12, B1, and all of these vitamins really help with, of course, the glucose within our cells, but in our neurons, but also making sure our neurons work well, and the serotonin and the dopamine and the epinephrine are working well in our brain, so all the neurons will be able to communicate back and forth with each other. Another vitamin that's important to brain health is vitamin D, and there's more and more studies coming out about vitamin D and how it contributes to brain health, but also bones and healthy bones, skin, and metabolism. And it says, I'll say, our study shows that many memory patients do have significant deficiencies in vitamins that affect memory. Treating these deficiencies is critical for improving memory function and efficient response to memory treatments. So whether you would know somebody that has dementia already or already living with memory issues, treating vitamin deficiencies can help that condition do better. So no, we're not saying it's going to treat it, but it can help them do better. And of course, we want to check for ourselves as well. Malabsorption of vitamins and fats does increase as we get older, particularly with the vitamins B6 and B12. And that is shown to slower neuropsychological effects. And these neuropsychological effects or deficits, you also see the same symptoms in young women with anorexia. So you can have malabsorption of vitamins because the body's not absorbing it correctly, and that can be due just to getting older, but it can be because of starvation, malnutrition, gastric bypass, anybody that has an IBS, or somebody that already has some cognitive impairment, so they're not getting the right food. But then there's a niacin deficiency, and this So it's the 3Ds: dementia, dermatitis, and diarrhea. These are 3 symptoms that we see if somebody that has a niacin deficiency. Mostly it's found in alcoholics because they're not consuming the nutrients, the leafy greens, the seafood, and the protein. And so they become malnourished, and you see the niacin deficiency. And you can find niacin in whole grains, fish, nuts, meats. But you can also see, or the symptom of it would be a rapid weight loss, of course, diarrhea, fatigue, and sometimes severe memory loss. If those are treated properly, those symptoms can clear up. The Mediterranean diet is one of the best diets to get all of these vitamins in. And of course, it depends on how you adhere, how strictly you adhere to the Mediterranean diet, but that diet really does include all of these nutrients. And talking to your doctor about supplements. The best way to get any type of supplement or nutrient or trace mineral into your diet is through your food. Your body absorbs and metabolizes food differently when you eat it as opposed to when you take a pill. But sometimes we might have to take a supplement, right? And like I mentioned earlier, the supplement industry is not really regulated. So really talking to, because it can be filled with a lot of fillers. So really talking to that pharmacist about what do they recommend as a better brand to go with, or doing your own research, of course. But folic acid has been shown for essential brain health, brain function, and emotional health as well. It helps with the production of the neurotransmitters in the brain, and it helps increase in nitric oxide, which is, it has a protective ingredient in our brain. It helps against oxidative stress, or it helps against, it's kind of like an antioxidant. So it helps get rid of the trash or the waste that our cells can make throughout the day. But low folic acid has been associated with depression, sleep issues, confusion, appetite loss. And if we have appetite loss, we might have an increase for other malnourishment issues, and then seizures as well. And then again, vitamins B6 and B12 are related to brain health, and our body doesn't absorb it as well as we get older. So some people can be deficient in it, but that can be an easy fix with a vitamin or B12 or B6 injection. But you can also find it in the things listed here: salmons, chickens, fortified cereals, beef liver, and that. And then vitamin E has antioxidant effects as well. So it helps clean out the waste that our cells make throughout the day, and found in certain nuts and oils, spinach and broccoli. And then vitamin D, like I mentioned earlier, you can get vitamin D through, of course, sun exposure on your skin, but also in oily fish, eggs, mushrooms. And like I mentioned, they're coming out with more studies about vitamin D. And then I want to talk about Creutzfeldt-Jakob disease. And this is a very rare disease. It's a 1 in a million disease. So about 1 person in 1 million have this disease worldwide. So it's a worldwide thing. And its typical onset is 60 years old, but it can be shown in much younger as that as well. And I'm going to call it CJD disease, but it is a human prion disease. And a prion what happens is there's a protein in our brain, and the prions kind of align the outside of the protein. Well, those prions become toxic. And what they're doing is that becomes toxic in that neuron, and the prion is able to multiply very rapidly. So then it starts to attack all the other neurons because of how quickly it's able to multiply and take over all the other neurons. And when it takes over these neurons, the neuron dies and it withers away. So it looks like on the pictures, it looks like there's little holes in the brain where the neurons are. So they call it a spongiform type dementia, because it looks like the brain looks like a sponge because of how it kills the neurons. This disease is very rapid, so usually somebody kind of comes on pretty suddenly. We'll see the symptoms, and then it progresses rapidly, and they usually pass away within 1 year of onset of the illness. The CJD does have a couple of different variances in there. So I mentioned they all belong to a disease known as spongiform encephalopathies. And this, again, because of the spongy holes that it makes on the brain tissue. This is a picture of what it looks like. You can see on the right side, and it does look like a sponge. And this, how the brain looks in this picture is different than what it would look like with an Alzheimer's disease or vascular dementia. So the effects of the disease, how it kills the brain, is different. So the variances of CJD are, there's the classic or sporadic CJD, and this is mean it appears for no reason. We have no idea why it appears in that 1 in 1 million person. There's no risk factor, but it accounts for about 85 to 90% of all the cases of CJD. It tends to develop around people ages 60, but it is also developed much younger in persons in their 20s and 30s. There's also hereditary CJD, and this is somebody that has tested positive for a genetic mutation that causes CJD. So if a parent has it and it's a genetic or a hereditary CJD, they can, 50% chance they pass it on to a kid. They can be tested for it. And then there's acquired CJD, and this is very rare, but it's transmitted by exposure to brain tissue or nervous system tissue that has been contaminated. And this can be from equipment and like surgical procedures, or blood transfusions that may have happened. Again, extremely rare that it happens. What you might have heard of CJD or has been termed the mad cow disease, because in the early 1990s, it did get our attention in the UK. There was a acquired CJD because people got CJD from eating meat from a diseased cattle. So that was termed the mad cow disease. We've never seen this form of CJD in America, and it's really linked to contaminated beef, which it's pretty much non-existent now, but that's what we did see it there in the early 1990s. But like I mentioned, it does come on pretty suddenly. So you have sudden changes, and they're continuous changes rapidly over that course of about 1 year. And you can see personality changes. So you can see whether it's depression or agitation or apathy or mood swings, severe confusion, memory loss. They can have blurred vision or blindness that happens pretty rapidly, insomnia, muscle stiffness. So it's like they're stuck. They can't move their muscles, difficulty speaking, swallowing. And then sudden jerky movements is kind of a more hallmark sign. And they're not necessarily aware of those sudden jerky movements or that they're going to come on, they're just happening. And then eventually they'll lose the ability to move or to speak and can enter in a coma. And again, the progression is about 1 year. So we have here some references on malnourishment, nutritional deficiencies, eating tips for seniors, and how to detect malnourishment in seniors. And then also references on getting help for alcohol and drug use disorder as well. I'll add that Beers criteria list or link on there if anybody wants to link directly to that Beers criteria as far as medication interactions as well when I send it out this afternoon. There's our information, but I'm going to stop sharing and see if there is any questions or anything anybody wants to share. And I will, I had a comment and I appreciate it. It said depression is not a choice. So being careful how you word that. And that is very true. Absolutely. Depression is not a choice, but we absolutely want to be able to treat, get help for depression and treat it as best we can. So thank you. Are there any other questions or comments?
Jamie, we might just do a reminder of because this is a series that we're doing on less common dementias. And so next week, we're actually going to talk about Lyme disease, Huntington's, how stress. So this is going to be a series for the next few weeks, and it will be at the same time on Mondays. So it's very interesting whenever you really start kind of looking into this. So that's why we decided to do this, because this is something we have a lot of questions about.
Yes, thank you, Holly. And I'll make sure y'all get the information about those, the series in the follow-up email this afternoon as well. Well, we appreciate your time. Hope buy you 5 extra minutes in your day. Be looking for that email this afternoon with the additional resources, and hopefully we see y'all next week. Thank y'all.